I'm particularly proud that in the last 2 years, the students have really stepped up. Early in the pandemic, the students came forward with a number of really interesting ideas about how they can do things in the community to help ease the burden that the people in the community have been facing. And I've also been impressed by the faculty and how hard they work to bring those courses online. Of course, none of this would be possible without the staff and their important work. I think what makes my school stand out is that we have a focus on health equity. And I mean that across the board. We have a focus on health equity in a variety of different aspects, in terms of maternal and child health, in terms of elderly people, in terms of gender, race, immigration, migration issues. So we look for inequities across a wide variety of areas, and we focus on how we can improve the health of populations that are disadvantaged. I think our school is uniquely well positioned to deal with the health challenges that are prevalent here in the southern United States. Chronic conditions. We have a strong emphasis on cardiovascular disease, strong emphasis on diabetes, two conditions that are very expensive, and also, of course, cardiovascular disease being the #1 cause of death in the United States. I think we're really well positioned to do research and helping to understand how we can improve the health of populations in those particular areas. And I think we also stand out in our focus on global health. We have a long history of working across the globe. We have projects on every continent virtually, and we have alumni on virtually every continent. And we've trained a lot of leaders who are really moving the field of public health forward in their countries. Perhaps the most pressing problem facing humanity is global climate change. And we here in New Orleans live in a region that is extremely fragile, one of the most fragile regions on the planet. I think that of emphasis on climate change, how it impacts human health, is an area where we really need to develop additional expertise, not only because of the importance to our local community, but importance to the world. Louisiana is one of the poorest states in the country, and Tulane is one of the more expensive universities. And we need to be able to provide a Tulane education to residents of this region because we have so many pressing public health problems in this region. And philanthropy has been critical in providing us with the ability to provide scholarships to students who otherwise could not afford a Tulane education. I think the future for the School of Public Health and Tropical Medicine is extremely bright. We are one of the fastest growing schools of public health in terms of enrollment. We are moving up in terms of rankings, and I think that we're getting more and more national and even international attention for the work that we do. As we continue to do work that's vital to humanity, I think that we'll continue our ascent as one of the leading schools of public health in the world.